A medical emergency can trigger instantaneously, even in patients who walk in for routine procedures with no prior symptoms. In that fraction of a second, the clinical objective pivots from the localized operative site, the tooth, to systemic preservation. This diagram shows the three primary mechanisms driving a patient's sudden collapse. These represent oxygen deficiency, circulatory collapse, and metabolic imbalance. Immediate management focuses on recognition, stabilization, and an efficient hospital transfer. To manage these events, the Indian Dental Association framework utilizes three distinct components: preemptive prevention, clinical setup, and the specific execution algorithm. Providing the highest probability of survival relies on executing a predetermined algorithmic protocol rather than relying on improvisation. The most critical step in emergency management happens before treatment, starting with meticulous medical history taking. This decision tree illustrates how regularly updating patient history identifies high-risk profiles like cardiac, diabetic, asthmatic, and hypertensive conditions. Severe high-risk patients are routed directly to a hospital setup rather than a standard clinic. For the patients cleared for standard clinical treatment, physical preparation of the workspace is mandatory. This centers on the IDA emergency drug kit. This matrix categorizes essential pharmacology. Level 1 is for immediate, life-saving intervention: adrenaline for anaphylaxis, nitroglycerin for angina, salbutamol for asthma, glucose for hypoglycemia, and aspirin for myocardial infarction. Level 2 contains advanced interventions: diazepam for seizures, hydrocortisone for shock, and atropine for bradycardia. Beyond pharmacology, the clinical team must have immediate access to specific hardware. This hardware hierarchy ranks oxygen delivery as the highest equipment priority. This includes a primary oxygen cylinder and regulator at the top, cascading down to the bag valve mask and specific airway adjuncts. Every drug and piece of equipment must be clearly labeled, highly accessible, and strictly monitored for expiration. Maintaining an unexpired, organized clinical arsenal reduces cognitive load. When a crisis hits, the clinical team relies on trained muscle memory. When an emergency occurs, the mandatory first action is an immediate stop to all dental treatment. This flowchart outlines the strict PABCB algorithm. P is for position, adjusting to supine or Trendelenbach. A is airway, ensuring it's clear. B is breathing, administering oxygen via bag valve mask. C is circulation, checking pulse and blood pressure. If circulation is absent, the team initiates cardiopulmonary resuscitation instantly. The final step is D, definitive treatment. This is the point where the specific Tier 1 drug from the emergency kit is deployed. Definitive treatment in the dental clinic always concludes with a hospital referral. Executing this flowchart rapidly requires the entire dental staff to maintain up-to-date basic life support training and predefined roles. A rigid, linear algorithm prevents panic. It ensures that critical failures, like a blocked airway, are resolved before secondary concerns. This timeline visualizes the anatomy of a successful clinical intervention, broken into three distinct phases. Phase 1 happens before treatment begins. The priority is gathering history and conducting an accurate risk assessment. Phase 2 is the emergency itself. The priorities are stopping treatment, securing the ABCs, and administering oxygen or drug therapies. Phase 3 occurs after stabilization. The final action is a secure transfer to a hospital. The reality of medicine is that even fully equipped specialized hospital wards lose patients to severe medical emergencies. In these moments, a dental surgeon acts immediately to provide the patient with the highest statistical probability of survival. In a crisis, a clinical team will not rise to the level of their theoretical knowledge. They will fall to the level of their emergency drills and physical preparedness.